Welcome back. Now, this is the final in the series of blood vessels in the human body. So let's go ahead and get started as we explore blood vessels going to and from the lower extremity. So let's start as usual with arterial blood flow. And in order to understand the blood flow into the lower extremity, we have to start in the pelvis. And so the blood vessel that leads towards the lower extremity is the external iliac artery. Now, as soon as the external iliac artery crosses the inguinal ligament, it's going to have a name change. So same blood vessel, new name. As soon as it crosses the inguinal ligament, it's considered to be in the lower extremity, and now we call it the femoral artery. The femoral artery has several branches in the thigh, none of which we're bothering to learn the names of. Drawing your attention to anatomy, you learned when you learned about muscle. In the adductor magnus muscle, there was that huge adductor hiatus, and the femoral artery will, as it moves distally, will pass through that adductor hiatus and end up being a posterior knee structure. So on the far left, you can see it appearing through the adductor hiatus, and when it is, as soon as it becomes posterior, it is called the popliteal artery. So it does not have to get down to the knee area to be called popliteal artery. In the thigh, as soon as it's a posterior structure, it is the popliteal artery, passing through the popliteal fossa. Then in the upper calf, I think you clearly can see that it's going to have two branches, one which will go anterior to the tibia and one which will stay posterior. The one that travels anterior to the tibia is the anterior tibial artery. Isn't it awesome when the names make sense? So the anterior tibial artery will continue distally and go to what is the dorsum of the foot, where it will have an arch with branches going to each of the digits. However, on the dorsum of the foot, it has another name change, and here it is called the dorsalis pedis artery. And this is one of the two peripheral pulses in the lower extremity that are palpated to determine if there is circulation. So just place your fingers flat. Don't push hard. Place your fingers flat and the mid part of the arch of your foot at the level between where the first and second metatarsal bones would be. And you can feel that pulse. All right, so the dorsalis pedis is the termination of the anterior tibial artery coming off the popliteal artery. The other branch off the popliteal artery is called the posterior tibial artery, and its pulse can be felt too. However, not here in the calf where it's got all the muscles. To feel it, go right behind the medial malleolus and just inferior and posterior to the medial malleolus. You should be able to feel this pulse as well. So those are the two pulses which are really important for distal circulation in the lower extremity. So blood flow in the lower extremity on the venous side is very similar to in the upper extremity in that we have a superficial venous layer, which then drains into a deep layer. So as far as the superficial venous blood flow goes, we're going to learn one blood vessel, but interestingly enough, this is the longest blood vessel in your entire body. And that's because distally, it starts right before your medial malleolus, and then it's going to travel up the medial aspect of your calf and up the medial anterior aspect of your thigh. So this blood vessel is more than 3 feet long without a name change, and it's called the great saphenous vein. And the great saphenous vein has importance in that it's often used for coronary artery bypass surgery, but because it has valves, they flip it upside down. So that's the great saphenous vein. And what it drains into is the deep venous blood flow, where I'll show you where it drains into, but we need to start distally and move our way proximally. So we're not going to do any deep vessels in the leg, but we are going to start in the popliteal fossa area where we clearly can see the popliteal vein. And then as it travels proximally, it also will disappear through the adductor hiatus and end up being an anterior thigh structure where we now are going to call it the femoral vein. And the femoral vein will be on the anterior thigh. It's always just medial to the femoral artery. And once it crosses the inguinal ligament, it will no longer be in the lower extremity and will be called the external iliac vein. And so now we are done with our travels through the blood vessels of your body. So make sure you have some practices of starting in one place and ending in another place. Start in the little toe, end up in the little finger, vice versa. And I will see you in class soon. Thank you for all your hard work and learning all these blood vessels.